Hi, good afternoon, and welcome to the Houston Health Department's live webinar for the lead-based paint hazard control program. We're excited to have you here, and our subject matter experts today are going to be Ms. Landry with our health department expert on lead paint. She'll be the first one to present, and then Mr. Reyes. So we just want to welcome them and welcome you to this presentation. Again, there will be a live recording of this that will be available to you later on if you do have questions. We do ask that if you have questions during the presentation that you leave your questions in our live Q&A chat. That's where we'll be moderating from. And during the course of the presentation, there will be time for questions and answers. So we'll allow the presenters to do that. So with no further ado, I'm going to have Ms. Landry take it away from us and give her piece of the presentation. Thank you.
Hi, I'm Demetta Landry, and I'm with the Houston Health Department, and I'm the community liaison for the lead department. And basically what I do is I go out and I educate residents and community leaders about our program. I talk about the hazards that we find with lead-based paint and how our program actually works. My main focus is to qualify families and homes for our lead-based paint program. First of all, why do we care about lead poisoning? Children under the age of 6 years of age and pregnant women are the most vulnerable populations. Children from low-income communities are 8 times more likely to suffer from lead poisoning as compared to moderate and upper-income children. Children from communities of color are 5 times more likely to suffer lead poisoning than their white counterparts. Per the CDC, there's no safe level of lead in the blood. And I'm sure you heard a lot about the hazards of lead poisoning this morning in the earlier webinar. Next slide, please. What are some of the sources of lead? The primary source of lead in a home is usually lead paint. Homes built prior to 1978 are considered at risk of containing lead-based paint. After 1978, it was banned at that point, and after that time, houses were not, paint was not used on homes that had lead paint in them. So we focus on homes that were built prior to 1978. Other sources of potential lead hazards are ceramics, candle wicks, jewelry, candies, pipes, medicine, herbal remedies, batteries, some cosmetics, spices, and imported foods. How is the health department combating lead poisoning? Our program, actually there are 2 federally funded programs, which this says 20 years, but actually it's been more than 25 years that we've actually had experience in combating lead poisoning. The CDC has funded Houston's Childhood Lead Poisoning Prevention Program, which they provide us with surveillance, education, and awareness programs. HUD has funded our lead-based paint program by providing us with funds to help supplement remediation of lead-based paint from homes. And we also have a Healthy Homes funding program to help make the homes healthier and safer. HUD also provides free lead screenings to children and pregnant women throughout its Environmental Mobile Unit project and in partnership with select WIC programs. High impact neighborhoods that we focus on. We do provide our program throughout the city, but recently, in the last 2 years, we were awarded a $9.7 million grant to work on 4 high impact census tracts. There are 2 in the 5th Ward area and 2 in the near north sides. These homes must meet certain criteria to qualify for the program. And if lead paint is found in a qualified home, these areas will be remediated. The program that we provide is at no cost to the homeowners. or to the renter that may be living in a home. Homeowners and renters can qualify for this program. Next slide. What can our program provide? At no cost to renters and homeowners for families that qualify for the program, we can provide painting of the home, wooden, vinyl, or hardy plank siding can be installed. We replace wooden windows and wooden doors with new aluminum windows and new doors. I want to let you know that we are not a repair program. However, each home receives work based on inspection findings. And you'll find out more about the inspection process a little later on in the presentation when Luis comes on. Next slide. How can a home qualify? To qualify for this federally funded program, a home must have a child that lives or visits the home, which is visiting means 60 hours out of a year, or have a pregnant woman live in residence. And the child has to be under the age of 6. So we usually say the child has to be from birth to 5 years of age. The home must be built before 1978. When we go out to look at the home to qualify it, we must see peeling, chipping, cracking, flaking paint on the outside. And then there's also some income guidelines that a family must meet. These are the main criteria, but there are other requirements that may also apply. And some of those are the house cannot be in a flood zone. The property taxes have to be up to date. Something that we run across sometimes is that the home is not in the resident's name, whereas a family member is deceased, say the mother, the spouse, and so we run into that as being a problem where the person living in the home must get the deed to the house in their names. So that is also a requirement that whoever is living in the house, owning the home, it must be in their name. Next slide. Looking at the key criteria in a little bit more in-depth look, like I said earlier, the homes must be built before 1978, and that's when lead-based paint was banned. And so any home prior to that will probably have lead-based paint. So that's why we're looking for those homes. We find a lot of homes that were built in the 30s, 40s, and 50s that are still standing. I believe in the 5th Ward area, there is probably over 4,000 homes that were built before 1978 and could potentially have lead-based paint on them. The age requirement of the child is 5 years of age and younger. And as I said earlier, they have to visit the home at least 60 hours out of the year. That could be coming in the summertime, visiting with grandparents, visiting with relatives. It could be 3 hours a day as if they were participating in childcare, you know, grandma or aunts are babysitting the children during the week because they have to have somewhere to go after school. So that all adds up to the 60 hours for the year if a child does not actually live in the home. Next slide. Okay, homes cannot have severe roof or foundation damage. We are not a repair program. We are a remediation program. So we focus on lead paint. That is not to say that there aren't some things that we will do to make the home healthier and safer. And that is something that Luis will tell you a little bit more about when he does his part of the presentation. But there can't be any severe damage because we are, like I said, we do not do major repairs. If there's small things, we can probably look into those things. Like maybe if a floor has some loose boards, we can possibly repair that, but not any major foundation damage. And if you look at the pictures that we've provided, it's showing you the kind of peeling, chipping, cracking, flaking paint that we're looking for. It's also giving you a good idea of what wooden windows look like. A lot of times when we're asking people if they have wooden windows and we're talking to them on the phone, they're looking at the frame versus the actual window. And if you can, as you see, the window itself on these pictures are all wooden except at the third picture, you can see where that would be an aluminum window, but the house is actually, the picture showing where the house is showing the peeling, chipping, cracking, flaking paint. Next slide. Oh, we're at the question portion already. Does anyone have any questions?
Okay, so this is the moderator. We're checking if we have any questions here. It looks like right now we have some questions. So let me go ahead and start with the first question. And the first question is, how much is it going to cost me?
This program does not cost the homeowner or the renter anything. All of the funds to provide the construction materials, the work, anything that we do to the home, it is provided through the grant funding. Now, I will say that in some instances when we are doing the work, the home, there are categories, and Luis, I'm sure we'll talk more about it. But if the house is considered a level 3, usually that individual or family will have to move out. And so at that point, we also provide moving for the family. We provide storage for mattresses and couches. We provide a hotel where the family can stay, and that is at no charge to them. But when I'm thinking and I'm talking to families, they do have to buy food. They are required to buy their own meals when they're out of their homes. So to me, that is a cost. But the actual materials and contractor work and all of that is all covered under the grant.
Okay, great, great. Well, we've got a second question, and it is, I am not the owner of this house. Why do I have to provide all this information?
Per the grant, we are focused on making the home safe and healthy for the person that's living in the home. So we qualify the house based on who's living in the home, not the person who actually owns it in some cases. So a renter is living there. So we want to make sure that they qualify for living by the program to live in that house, and that we're making that home safer for them. If it is the owner, then the owner would be the one qualifying for the program. In some cases, we have vacant homes that we've found that have lead paint, and the owner of the home, if they're a landlord, they usually rent it out. They are required to find us families to live in that home, if we remediate it for them, that fall into the criteria guidelines, meaning they must fall into the income guidelines, they must have a child under the age of 6 in residence or visiting, and all the other criteria of the property taxes and everything else being taken into consideration.
Okay, now actually, hold on here. I don't want to take up too much time with this, but let me ask a couple more questions. We actually have some in the chat. Will this program affect any other benefits I'm receiving?
No, it does not affect any benefits that you're receiving. The information that we collect from an individual is strictly for our program. We don't share it with anyone other than HUD when they're doing the auditing of our paperwork. So it does not affect WIC benefits, SNAP benefits. We do not have anything to do with immigration or anything like that.
Okay, no, that's great. Okay, so just to let you know, we've got a couple of questions in the queue, so I'm going to kind of just go through them A couple more. Will we lose our house or property to the city?
No, you will not. Our program does not put a lien on your home. We do ask that you not sell the home after we do the remediation, because we're making that home safer for you and your family to live in. Or in the case of a renter, a landlord, we're making the home safer for the renter. And so we ask the landlord not to raise the rent or evict the tenant before 18 months.
Okay. The next question is this available for Galveston County?
Not under the Houston Health Department, but I would have to look into if there's a program in Galveston County. There is one in Harris County. You can leave me your email address, phone number, and I will find out that information and contact you.
Absolutely. And just to let you know, some of these are being posted anonymously, which is fine. But again, we can leave your information, your contact information, Mrs. Landry, in the chat below in the Q&A live chat at the end of both of their presentations, so that you can feel free to email your questions privately if you need further detail and more information. So it just sounds like this is a very popular topic. So I have a couple more questions here. I'm going to try not to ask any questions that have already been asked. Can you take care of items that are not lead issue related?
Can you repeat that again? I didn't quite hear you.
Oh, can you take care of items that are not lead issue related?
That would be up to the inspector, because that we do have the Healthy Homes grant, and that would be something that you would talk with the inspector, which Luis, I'm sure, can address that better than I can, on what items or what areas that we can focus on with that type of grant money.
Okay, so I'm gonna do about 3 more of these questions because they're popping up, and this seems like a very popular topic. So we appreciate everyone participating. Great program. What's the average time a family can be out of the home?
It can range anywhere from a week to 3 weeks, depending on the scope of work that's being done on the home. Usually what I've seen is if they're just getting siding on the exterior of the home, the family doesn't have to move out. So they're there through the whole process.
Excellent.
It's usually when the home it needs a lot of work to be done, and they're removing those wooden windows because they don't want anyone in the home getting affected by the lead dust when they're removing those windows. So that's one key reason why they ask them to move out for the time.
Excellent. And it looks like here is, can you do duplexes?
Yes, we can do duplexes. The only issue is we have to have both parties agree to participate in the program and provide us with all the necessary information. So we can't do one side of the duplex if the other tenant on the other side says no.
I guess that's the question. It's a little bit unclear, but it looks like they're just asking, what if you have a bad roof or foundation? Is that something that they can get fixed through the program? I imagine maybe not.
If it's major roof damage or major foundation damage, that would be something that has to be done prior to us coming in to do remediation. If it is a, say, small leak in the roof, they can probably do something with that, but that's going to be a Luis question for sure. But from my understanding, major issues can't be handled under our program. It would have to be done through another program, but it's a case-by-case basis. So the inspector would be the one to make the determination what we can and can't do.
Thank you so much, Ms. Landry. We had a lot of great questions from the audience, a lot of interest and participation. And I think you're absolutely right. I think that Mr. Reyes might be able to answer some of these other questions. So, keep asking your questions in the live Q&A. We see you. We're going to move the presentation along to Mr. Reyes. Thank you again, Ms. Landry. You did an excellent job. We really do appreciate your expertise. So I'm going to go ahead and go on to the next slide. And we will have Mr. Reyes present. Go ahead. Take it away, Mr. Reyes.
Good afternoon. My name is Luis Reyes. I am one of the lead inspectors with the City of Houston's health program. The following slides I'm going to cover is primarily some of the work we've done on some of the houses. These will be within the last couple of years to the most current ones that we're doing. I will touch bases on some of what Ms. Landry touched upon and show and explain some of the requirements for the program itself. So here again, we have an example of what we look for when we go on the field that qualifies some of these houses. The areas in red is the damage that we look for. That's primarily the chipping, the paint that gives us an indication as to what the lead might be in. And so we basically use our equipment to test the paint, and it's essentially a handheld piece of equipment that we go out there and we test the paint, and it gives us a reading, and that determines whether the paint itself is a hazard to the family in the facility. So this is the after. So once we've done the estimation and we've determined that the house has lead, the contractors go out and they perform the work. So as you can tell on this picture, and most of the slides following this would be similar in nature as to the work that's done before and after. As you can see there, the vinyl siding that has been placed on the wood siding before, you can tell the windows have been replaced. If they're wood windows, like Ms. Landry's mentioned earlier, those windows are replaced. The only stipulation is the house does not get wooden windows replaced if it is a historical property. If it's a historical property, there's limitations to what the program allows based on what the city allows us to do. So in this case, the windows on this house were not, they were wooden, but they were not, it was not a historical property, which allowed us to remove the windows and replace them. Now, a lot of the damage that is on the houses is covered by the siding, and a lot of the superficial damage also is covered. So we paint, they cover the wooden siding, and they remove the wooden windows to alleviate and remediate the lead contamination. And again, here we have some more of the damage. You can tell some of the siding itself is damaged, cracked, or broken, missing some of the wood paneling. And again, the lead is primarily what we look for is the signs, the telltale signs, which is the flaking, chipping, and peeling of the paint itself. Again, same house, just with the after images of what's been done to it. So the colors are chosen by the owners or the renters based on their preference. The contractors will go out there, they'll give them some examples of the colors that they have. So they get to choose a lot of the aesthetics regarding the program itself. Again, focusing on some of the damage, this is what we look for. And a lot of times when the qualifiers go out there, this is some of what they look for themselves too. These are the marks that they look for, and a lot of times it's spot on, and they help us quite a bit when they make these observations. In this case, the house itself is primarily brick. So right now we're going to be focusing on the soffits, which is the area on the upper part of the house itself, and the trim around the house itself. So we work with both houses that are all wood or combination of wood and brick. It doesn't really matter if the program covers, as long as the lead itself that's on the house is positive, then we're allowed to work with it. And there we go. So on this one, we didn't touch the brick. All they did was remove, scrape and paint the areas that were contaminated. As you can tell at the very top, they went in, they scrape all of the lead paint off, make sure nothing gets around in the areas. They cover the area. That way it doesn't, the lead dust doesn't scatter itself, and they do take precautions when it comes to removing the lead. They apply plastic, poly, it's a form of a thick plastic, basically coating that they place in the floors to trap a lot of the waste and the lead dust that does fall on the ground when they do some work. Again, as you can see, some of these photos range in damage to the severities of the lead itself. On this one, we have holes in the walls. The windows themselves, as you can see, sort of also are wooden. So this house qualifies for a lot of the services that we offer with the lead program itself in remediation. And here we go again. The paint, the vinyl siding is one of the biggest things that most of the houses are covered with. Sometimes they might have a different kind of siding, which is a hardy plank, and that in itself is also either removed if need be, or we replace the whole house with the same material. As long as it's matching, and as long as the lid is removed, we are able to match the siding for the most part with either the hardy plank. If not, then it's all wood, then we cover it with the vinyl siding. Next slide, please. Same thing, we have here the damage that's done to the fascia. You can see the walls have some paint peeling and chipping. This one has metal windows, so on the following slide, there we go. And again, that's vinyl siding chosen by the owner. And on this one, you can see that the front door was replaced. A lot of times the door itself is also lead contaminated. We're allowed to replace the door just to simply make it more habitable and easier and safer for the residents. The windows were replaced, and a lot of times we can do some of the repairs and some of the changes that Ms. Landry mentioned earlier, that all the clients ask, can we replace this? Can we change this? Can we do this? Again, it's more of a case by case basis, but we do have some wiggle room in what we can do. Next slide, please. Here again, they're focusing on the windows primarily. These are the wooden windows that Ms. Landry mentioned earlier. Next slide, please. And here we go. So on this one, you can see all the windows have been replaced with the new aluminum windows. The walls have been covered with aluminum siding. And again, the colors are chosen by the residents or the owner. It's not something we dictate. We don't tell them what colors to choose. They're given a selection, and they are pretty much free to choose from the contractor's selection of paint that they have. Next slide, please. Okay, you can see on this one clearly the repairs that they were done. You can see the windows replaced. You can see the gutters that were installed, and that door on the right-hand side. Again, going back to what Ms. Landry mentioned as far as what we can offer as far as the program for the lead and the healthy homes itself. There's quite a few things we can do, again, within our limit, but for the most part, we try and do our best, and we do help out the owners and the residents as best as we can. Next slide. Now, the following slides are going to be the program's latest and most recent remediation houses. So these go back maybe about a month or so. So here we have, and the address is actually on there because the owners, when they sign up for the program, they offer their permission for us to use their before and after photos and their information to show exactly what we're doing right now, and show other people what the program can offer and what the results can be. So this was done back in September. So in the span of about 2 months, I believe, from the inception to the end is when this house was done. As you can see, again, the siding was replaced. Any of the damaged wood that you can see on the upper picture is repaired. It's replaced. That way we can actually have a firm and solid foundation underneath to put the vinyl siding or any other siding that we have that they might need. the paint and the gutter. Most houses are always equipped with the gutter. They don't have them. We install the gutters as a one of the primary, most basic of offers that we give them to prevent water from spilling next to the foundation and to just simply keep the water away from the entrances so that there isn't any accidents in regards to the residents living there. Next slide, please. It's the same house. We can look at the front. The changes, you can see the windows were stripped. They're covered in new painting. The vinyl siding is replaced. And if you can see in the back, you can see kind of a before and after what the facility or what the property looks like. So there are more properties or more houses in this property, and they're all pretty much in the same similar situation. And we're more likely we'll get to those two eventually down the road, but there is a waiting list, and we will do very similar procedures on those houses as well. Next slide, please. On this one, going back to the wooden windows, this one was completed back in September. Those windows in the front, those were highly contaminated with lead. And with the program, they removed all three windows and reinstalled. It might not be the exact same match, but the contractors on the program do their best to match large windows, small windows as best as they can, because a lot of times some of these windows are no longer available. And it's something that just isn't feasible for us to find and to replace. Next slide, please. Same house. These are the windows in the back. As you can tell, the condition the window were in the past. All that paint that's around the trim and the frame itself was highly contaminated. So the contractors come in, they scrape and paint the areas, again, catching lead, dust, and any waste on the plastic that they placed in the bottom. During this particular type of work, like Ms. Lambie mentioned, the residents are required to leave the facility for the most part, because they are not allowed to be anywhere near the work that's being done. So again, as you mentioned, they might be displaced for about 1 to 3 weeks, depending on the number of windows and just the length of the work that's required. In this particular house, we did about 8 windows, I believe, so that takes a while. So they might have been displaced for the longer period of time, which would be like 3 weeks. But we do not recommend anyone. Sometimes we have issues where they can't move for reasons of their own. They cannot be relocated. But we tend to work with them. So in this situation, again, it's a case-by-case situation. But we do tend to work with the owners and the renters to try and get the work done and make the work itself safe for everybody involved. Next slide, please. And this was back in October, the most recent one. So this one is actually one of the bigger ones that we've done as far as helping with a lot of issues with the Healthy Homes program and the lead program. So if we switch to the next slide, we'll see all the work that has been done. Okay, this is the exterior again. This is the whole house, the inside and outside, and the vinyl siding has been placed on the wood. Now that building, that section on the outside and the back is not the original. It's not originally part of the house. So we were able to assist with covering that house or that section of the house itself with the vinyl siding itself. Next slide, please. And you can see again the before and after. This particular wall was in real bad shape. The owners try to make their own repairs, but they can't. Again, this is a historical house. Again, going back to the limitations that we have with the program, we're not really allowed to do a lot of work when it comes to the windows with historical homes. So in this particular one, we had to match the siding with the original siding based on what, again, the city allows us to. This one is going into the interior of the house. You can see the massive change between before and after. So the contractors come in, that wall that you see at the bottom is actually the wall where the TV's at. So they had a missing door, the contractors come in with the program, with the Healthy Homes program. We're able to do quite a bit of work. Again, going back to what Ms. Lambie said, it's a case-by-case situation, so we can't just offer or promise these kinds of assistance. It's a case-by-case situation, and again, we are not a remodeling program. It's just a lead-based program that we help as long as we're making the house safe for the residents is our primary goal. But again, it's not a remodeling program. We're not there to completely remodel someone's houses, but we do and are able to perform some of the necessary work that they do ask us. Next slide, please. This is that same wall from the previous picture, but this is in the bedroom. And you can see the massive change that they've done. They've closed off that wall. They put in brand new drywalls, and they're putting, also you can see the covers. So all the covers for the electrical outlets and light switches are also replaced again to make the house safe for anyone living in that home. Next slide, please. This is their kitchen. You can see the walls again, the door itself in the background, and the floor. If you look at the floor, there is actually, in the upper picture, there was a hole right in front of that refrigerator that the owners had drilled and cut into the floor itself. So when we went in there, they asked us if we could do something about it. We said we'd look into it. Sure enough, we were able to find a way to get the contractors and talk to them, see if they were able to do something to help the family out. Sure enough, they were able to cover up the hole, plug up the hole, and then they were able to put an entire new floor covering throughout the kitchen, living room, and that dining room area. Next slide, please. That goes back to the floor that I was referring to. So they were able to, again, strip the entire floor previously, sand it down, and apply this new grinding floors for the family. And next slide, please. The above is the kitchen. That's what it looked for like. Unfortunately, they had no lights at the time when I went to do this inspection, so I was only able to take the same photo again. But you can see that the door in the back, they framed it off. They strengthened the area around it, and they covered that back wall with brand new drywall to make the home again. They had found some kind of moisture in the walls. They removed the drywall to alleviate that as well. The next slide, please. Oh, we're done. So again, the program itself is not a remodeling program. We offer some assistance, and we do have the capability to helping, but in the end, it's geared towards helping kids with not being contaminated or being exposed to the lead dangers.
Yeah, well, thank you so much. This is Priscilla, the moderator, and Mr. Reyes. I mean, you did an excellent job. We have a couple of questions that have come up, and what I wanted to do was get those addressed, but there is definitely a lot of interest. You guys have gotten a lot of great comments in regards to this is an awesome program. We love it. Great pictures. So, I mean, I think that, people are very excited about what you guys have to share. So this is really great information. So I'm just going to kind of ask some of these questions. Will we lose our house or property to the city?
Okay, that's a similar question to what Benito was given earlier. No, there is absolutely no way that we get involved with that. We are just simply there to help, again, the families with this lead hazard. We don't get involved with that. We have absolutely no interest in taking anyone's property. That is not what we do. And we have to reassure people constantly when we go out there when we meet them. It's like a constant thing. We are there here to help, not to harm you guys.
Yes, no, that's great information. One of the other questions was, what's the average cost spent on a house, and what's the highest cost ever spent?
Okay, so again, we have the two programs. We have the healthy homes and we have the actual lead program itself, the grants. So there is a number that we follow. There is a amount that we can't exceed, and there's a certain number that we want to keep an average on, I guess. So with the lead program itself, we tend to stay below 20,000. So we kind of have to hit the 19,999. So we cannot exceed 20,000. So it doesn't mean we're gonna spend that amount. It just simply means we have that amount that we can spend on a property and house. Each house is renovated or fixed or remediated based on a situational case by case situation. Some may spend as little as 5,000-6,000. They might just simply need the vinyl siding on the outside, but they have nothing else going on. So that'll just simply be a simple quick fix within a couple of days. Others, like the one I just showed them, the last slide, that one was quite a bit. It was, again, the healthy homes, the outside, and a lot of the other smaller issues that arose that we came across when we did our contractors were out there. That one can run up to like 16,000-17,000. Again, the price is not an issue for us. It's just we're trying to help the families and the owners of these properties. So that with the lead program, again, the main grant is up to 20,000, give or take. The healthy homes allows us a $5,000 budget per dwelling. Now the healthy homes, that one allows us to do more of the internal fixes. So that would be putting in like electrical covers, switches, outlets, maybe in the exhaust fan if the house doesn't have one. If it's broken, then you put that in to help again with circulation in the house when it comes to cooking, and to just make it healthier to be inside the house. Smoke detectors, a CO detector in the houses itself, and simple little fixes like that. If there is an elderly individual, we do tend to put grasping or handles in the restroom and the shower itself to help them in and out of the shower itself. So there are things that we work with the client if they ask us, then we tend to help them out again on a situational case by case situation. And again, it's a nice situation where we communicate with the owners and the clients, and they tell us what they need, and we tell them what we can offer and what we're able to give them in return.
When you heard 2215 and 2213?
Okay, I think, are you guys hearing that? I think I hear something in the background. But anyways, okay, so one of the other questions, do you weather wrap under the siding being replaced?
Yes, they do. So when the contractors go out there, they will remove
But you don't have
it
to.
based on the damage that's on the walls itself. They'll remove the damaged rotted siding, whatever it is. If there isn't insulation, if there isn't any weathering behind it, that contractors are required to put the weathering and the insulation
No.
or back into the areas that they remove. Again, like situation again, it's not that we don't go back and completely remove all the side. It's based on sections. So there's only a 50-foot area that needs to be removed and repaired. That's what they focus on. But they do put in the weathering and the insulation back into its area.
Okay, excellent. And the last question, you know, we had a lot of great questions, a lot of good comments during this. Actually, okay, I had 2 more new questions that just came in the queue, but there's one question that says, you know, can you do a home where a small daycare is working as a business? So it looks like they're saying, you know, it's my home, but I have 6 kids.
That one, I think, would be more like Ms. Landry mentioned earlier. If you can contact her or contact the main office and ask them that question, they might be able to help you more, because I wouldn't be comfortable, I guess, trying to get information on that. I guess, yeah, they'll ask you what the requirements will be, and they'll let you know what they need from you, and as far as the qualifications for that particular situation. To date, I haven't come across that right now, but again, there might be something that our liaisons may have come across at one point or another.
Absolutely, absolutely. And you know, one of my other moderators, just so that you guys know, she published a link. You know, here are some helpful websites to the Health Department Environmental Division that you can go to directly if you have a lot of these questions. You know, these are just our subject matter experts, and they're trying to field these questions as they come. So we appreciate your inquiries and we appreciate our experts here. So this is going to be the last question because we are kind of going over time. Is this program available in Montgomery County?
Again, like Landry said, I think it's the Harris County is, as far as we know, what we focus on. There might be a program in that county, but again, we might be able to help you with that question if you direct those questions to information that's provided at the end of the program itself.
Yes, yes. And there will be, you know, thank you so much, Louis. I think that concludes our questions, our Q&A section. And I think what we're going to do now is kind of wrap up the presentation. I'm trying to think if there was it. So here is, excuse me, their contact information. If you wanted to go ahead and write that down. Also, just the lead-based paint hazard control program. You can call their general number to get maybe some of those specific inquiries, answers to those specific inquiries. We do appreciate your time, your curiosity about this program. And again, there is going to be a recording of this presentation. I think that there has been a lot of valuable information that has been shared. A lot of people have definitely learned about the great program that this is and all of the help that our team can provide as a public service. So we are so happy, so excited, and so thankful that you joined us today. And again, I want to personally thank both of our presenters, Mrs. Landry and Mr. Reyes. They did a great job. And hopefully we'll be coming to you again live with more questions. So, you know, definitely let us know if you enjoyed this topic, if this is something you want to learn more about. And, you know, we can get this to you again. So, all right, you guys, well, have a great day and we will talk to you soon. Thank you.
Thank you.